Hello, everybody. My name is Dr. Alicia Reiser. I am an occupational therapist who uses some fun and new technology. So today I have with us Vanessa Howe. She is the Director of Technology and Integration at HoweRT. By trade, she is a physical therapist who integrated resonance-based microcurrent into her PT practice starting in 2005. It was a very new technique at the time, limited primarily to professional athletics. And since then, Vanessa has been a national instructor who is viewed as an innovative programmer in residence modalities of both current, electrical, stim, and magnetic fields. She has taught physicians, therapists, and trainers from all over the world, and she is regarded as one of the foremost authorities in the use of microcurrent for athletic injuries, both working directly with and consulting with some of the top athletic cases in the country. Vanessa works with athletes from the NFL, the NBA, the MLB, Olympic sports of gymnastics, soccer, NHL, and many NCAA sports. Meanwhile, her clinic continues to serve a general pain population in the suburbs of Detroit, Michigan. So welcome, Vanessa. I'm so excited to have you here today.
Thank you. It's a pleasure to be here. Absolutely.
So tell us a little bit about how does the microcurrent unit that you have developed with your company, how does it work?
So it is first and foremost microcurrent. So there's two aspects of why it works. And part of it is microcurrent, and what part of it is what you alluded to, this side of resonance, which is frequencies. So microcurrent components are classic. Microcurrent devices have been used since the 1950s. They are incredibly safe. It is tiny, tiny current in the millions of an amp. So most people don't even feel the type of electrical current that we're putting into the body because the body sees it more as self. Microcurrent has been used for a long time in rehabilitation as well as aesthetics because it increases cellular energy. So there is actually research that shows that when you put a tiny current into the body, it increases the body's cell molecule of energy, ATP, by 500%. So that's a large boost of energy for the body to use for healing processes, circulation, all of those kinds of healthy metabolic processes. And then in addition, all microcurrent also has this natural propensity to increase collagen and elastin. So that's the reason why the largest use of microcurrent devices out there are in spas, by estheticians for wrinkles and skincare. And a large body of the research is actually around that same area. So all microcurrent lays down collagen, lays down elastin, and gives us these extra energy boosts. For that reason, the other purpose in rehab that we've used is PT and OT. We've used microcurrent for many years for wound healing. As well as bone stimulating. And so those types of devices are still out there. You might see them. They are still microcurrent devices. What makes ours really the next level is this side of frequencies and resonance. So the technical term of the type of microcurrent that we use is called frequency specific microcurrent. So this is a type of technology that uses frequencies. Now, every current that goes through your system in your body has a frequency. Yeah, even a larger electrical stim. So the traditional e-stims that you see in your PTOT offices, where it's causing a muscle contraction or it's blocking the pain pathways, all of those technologies, you have a frequency. We just use it intentionally. So all electrical devices have frequencies, but also what we find is that all of our bodies, all of our tissues in our body, all of our organs, they have a frequency as well. It's a bioelectric, biomagnetic signature that says, I am, you name it. So I like to use the example of the liver. So the liver tends to resonate around 35 hertz. If there's something off with that liver, so alcohol consumption, toxin exposure, fatty dietary issues, the liver will be somewhere around 35 hertz, but not at 35 hertz. So the idea of resonance therapies in general is if you feed in to the body that correct frequency, will the liver remember that it should be at 35 hertz. And what we find is that, yes, it does. And when we've actually tested that with blood tests for liver function, we found that most livers, I would say most, but in my case, all of my cases I've ever done this with have done this, the liver enzymes will normalize when you run these proper frequencies for the liver. Now, ours are a little more complicated even than that, because they're, as you know, Alicia, the programs are constantly moving and changing, and that's because we use two frequencies, one that targets a target tissue like the liver, and one that might also theoretically target a pathology like a fatty liver or a inflammation or a specific even toxin. So we have frequencies for all those, and the programs are actually complicated, advanced cycles of these frequencies to reach the goal for that patient, whether that's a healthy liver or whether that's pain reduction, nerve inflammation issues as well. So you've seen, we can talk about all the fun stuff. So in a nutshell, it's actually kind of complicated, right? So in a nutshell, that's it. And I always kind of tell my clients that I became an early instructor in this work in the early 2000s, and I saw amazing changes in my practice for pain control, for injury recovery, for athletic recovery, you name it, for neurological issues. And I always say I didn't really create this type of technology. I took something very complicated and made it easy enough that pretty much anyone can use it, and easy enough for practices like yours to be able to just integrate it right in without having to have all that knowledge base behind it.
You have favorite programs then that you use?
So that's like asking me to choose my favorite child.
Oh, right.
I did. I had a client not very long ago that came in and they had gotten a unit here locally just a few weeks before it. And they're like, I just put it together that you wrote every single one of these programs. And I'm like, yes, I did. But I think your favorites depend on where you are in your life. So I am a menopausal mid-50s woman. So my favorite program is night anti-aging. So it does have the wrinkles program in it just because we can, but it's actually night anti-aging from what I call functional medicine perspective. So a very integrative, holistic, it helps the body to wind down, to go to sleep. It quiets the adrenals, which helps an adrenal cortisol kind of perspective. It has a part of it that actually resets what's called the HPA axis, which is your adrenal, thyroid, pituitary, which is critical for those of us in hormonal phases of our lives. So it helps. If I run it twice a week, no hot flashes, right? As soon as I don't, then I have that issue. But my new favorite is actually, we can actually kind of launch it. I don't know if we've even talked about it. We've seen some fallout from post-COVID that actually ties into changes in the past that we've only seen in our mold, Lyme, and chronic Epstein-Barr populations. And in those populations, there's something called CIRS, which is chronic inflammatory response syndrome. And it has to do with when an infectious component or a toxin like a mold comes into the body and creates kind of havoc with regards to certain very critical parts of our I would say immune system, but it's over our entire way that we function. So it impacts the vagus nerve, which communicates to the heart, and it affects the brainstem, which also like heart rate, breathing, and then there's an immune component. We were able to actually put this together with concrete blood work and hard data in our NFL clients. And what we saw is that people weren't healing in the same way that they were before with the same programs. And then as some of our very astute physicians started to investigate, we found that we did see some changes in immune response that is related to this. So there's a new program that is called Post-COVID Master Inflammation Reset. And I do it at least twice a week as well. And it just kind of resets all of those kinds of impacts from, whether it's from that or whether it's from mold. I'm in Michigan, so we always have mold. People are like, you have a lot of mold programs. I'm like, well, I'm in Michigan. So it really helps offset some of that. I don't want to say trauma, but the impacts of those kinds of things. So if you look at the people who are like true long haul and really having challenges, it's in this energy component, the adrenals, in this a lot of this vagus autonomic heart rate kinds of things. And it was interesting, we just had a client who got a unit about a month ago, and within a week, her primary issue with long haul was a racing heart rate, and she said it stopped after the second time of running that program. So I see that as really not, I'd say it's my new favorite child, but it is because I think there's impacts into it that people, even for those of us who feel healthy, there is some impact to it, unfortunately.
Yeah, that's so crazy because we notice after people do have an episode of COVID and their concussion that all of their visual efficiency skills decrease, and then their fight or flight gets activated. So that is therein ties with the brainstem and the cranial nerves because those impact our eye movements. And then with the vagus nerve, we are very strong components of vagus nerve activation here too, because a lot of that sympathetic nervous system drive that occurs after the trauma from concussion. So we might use that even for our people who don't necessarily have a diagnosis of the long COVID, and to see if that might integrate a little bit with our concussion folks as well.
I'm actually telling people that everybody should try it, right?
Mm-hmm.
That's why we've made it a standard program on all of our home and Sport Pro versions. Those are the versions that are usually in the homes. There's a shorter version on our new rehab component as well. That's a little bit more clinic friendly, but it really is a huge impact. And I should have added, yes, the concussion, brain injury, stroke population is one of the other areas that we see having some of these issues. There's no real downside. In fact, I had a client who doesn't really have a lot of like major symptoms since COVID, but she had COVID recently. And we put it on her newer unit, and she texted me back 2 days later and said, wow, I feel so much better. I didn't even know I felt bad.
Right. Yeah, and that's what's great too. And I like how you explained too that it has the energy crisis or the energy ATP activation with it, because that's typically what happens in our concussion population, right? It's an ATP energy crisis that is a cascading effect, which impacts all of the symptoms that we see here in the clinic. So that's a good thing for us to add when we're educating our patients as to why it works, because it boosts that energy production.
And that's a critical, it put it together when there was research that was published about a couple of years ago that talked about one of the major impacts of concussions is this immediate drop in this brain cellular energy. And it started to make sense to me why our concussion programs really work as well as they do, because we're a huge donor of ATP, cellular energy, at a time when that healing injured brain really needs it. So it's another reason into looking at getting early intervention, right? Your community is really blessed to have you guys there as really a beacon for people with concussions and head injuries, because they're not well-known modalities, and they're not well-known approaches. I have seen some doctors that are starting to put together comprehensive programs that include this, but not at the level of what you guys are doing. You guys are next level.
It's amazing too, because of course, when you have a concussion, your depth perception is off. You're more prone to be bumping your head again, or just having that black cloud that follows you, that you just got into another car accident and all of that sort of thing, or random limbs fall down while you're driving, and it's a long story, but things like that kind of happen. And so we have people come in, and we've just put on the acute concussion program and run them through it, just so that energy crisis doesn't occur. We nip it in the bud as soon as we can get them. So even if we're already seeing them for that post-concussive injury, if they have kind of bumped their head and had maybe a subconcussive blow, or have just been reporting increase in headache because of a whiplashy kind of event, then too, we've been throwing that, the shorter version of the acute concussion program on. And I do feel that it has sped along their recovery so that they don't have that spiral again and start off, at square one. So that's been helpful for us as well.
kind of started that, but Alicia, could you talk about a little bit about how you use the technology in your clinic? Do people have to be therapy clinic patients already established, or how does that work in your practice?
Typically, we will use it on patients that we already have established. Our clinic is primarily post-concussive people that have tried other avenues and have not necessarily been successful. And I think part of what helps us with our patient care is that we use it almost as like a passive modality. Like when people come in, we will put it on them in the first couple minutes. And then we typically will use the sympathetic nervous system reset program because of how when we activate our visual system, there's an accommodative reflex that happens as well. And so that is relatable to our fight or flight system. So we try to get that accommodative response down so it's not so hyperactive. So we put it on that sympathetic nervous system reset. Or if they're more of a whiplashy cervicogenic kind of patient that just by looking down at the table with the activities that we're doing, we will put that one on. So it's usually the whiplash, the neck pain, or the sympathetic nervous system reset. And so we kind of just allow them to have that happen over their treatment cycle, and then they can their endurance, their activity tolerance, it's much longer, and they can sustain the whole hour treatment that we offer here. And so that's typically how we use it here. We want to have if you're having a bad day and you want to come in and use our unit, we want to kind of add that as almost like a wellness package. We're just not there yet. But that's kind of the goal of what we want to do. And so those are typically the programs that we run.
Yeah, we call those setup sessions. So, and in my practice, and for those people who don't understand, I had a very large practice. That was how the technology and the programs were refined. We did about 300 to 350 treatments a week. In a 7,000 square foot space, which is huge, right, for an integrated practice. And that's how we actually did that. So there absolutely is room for that. I see you guys growing in a lot of ways. And one of the things that I actually say about your practice is that you guys still do work with some insurances. And this technology is a grade 2 medical, meaning it is approved by the FDA, and thus can be used in practices like yours and build out. The insurances aren't always very good at actually ponying up to buy them for home use, which is really unfortunate. But I know that you guys have had some success in that realm as well, which is really great for the clients.
We have, and what's great too is that we do a lot of interoceptive awareness in our sessions as well. And so when they come in, we're asking, what are your body signals? Like, what is your headache? How are your eyes feeling? Do you have nausea? And so we're asking for those body signals because those are going to equate to an emotion like anxiety or even depression or sadness or happiness or overwhelm. And so we integrate those two modalities together. How do you feel at the beginning of the session? Now, after the session, after you've had the MENS device on or the microcurrent device on, how are you feeling now? And then they're able to tap into that interoceptive awareness so that they can self-regulate, which has also been very, very helpful with our clientele based on, their diagnoses and that sort of thing.
Absolutely. Absolutely.
So I think we kind of touched on this a little bit, but so is it mainly the ATP and the energy solution that you're offering to us? Is that why it works with our concussion clients?
So it's fascinating that you say that, because when we first launched the concussion programs, here's the story behind it. In traditional FSM that I used to teach, there's a program that was called the Standard Concussion Protocol. And I never really liked that name because it wasn't actually for concussions, and people would be confused by that. And I had a client who came to me. He was an older, he was in his 80s at the time. An ex-NFL football player. So he was in his 80s when I saw him, but he was big in the 1970s when they didn't have helmets and they didn't have all the protective gear that they do nowadays. And he came to me the night after he had been to a Hall of Fame dinner. And he had tears in his eyes, and he said, Vanessa, all my friends are falling apart. They all had this CTE. So-and-so's wife has to drive him, and just really the long-term chronic impact of all of those concussions in this population. And so he tearfully asked me, he said, don't you have a program that can help them? It makes me want to tear up when I tell it, because it was such a heartfelt moment. And I was like, yeah. And I realized in my background as a concussion head injury patient or practitioner myself, I was like, no, we don't. And so I went back to the drawing board and I created programs that really were, if I were going to heal a brain that was traumatized, how would I do that from a frequency perspective that I knew? Now I can tell you, and you know this, the programs are really gosh darn long, and I tried to make them shorter. I really, really did. But when in the development, we put them out on the floor, and we'd get like verbal feedback, like your patients, and they'd say, I feel all better. Like, I mean, this was often after one treatment, and I was like, wait a minute, what do you mean you feel all better? And working with people who've had concussions and head injury, they can't always perceive those changes, right?
Mm-hmm.
So we started doing a couple different objective types of measurements to measure, are they really doing better? And what we found is, wow, yeah, they are. And so we used SCAT, which is the sports concussion assessment tool, as well as IMPACT, which was a huge bringing in. We had a physician and a PhD psychologist. We had an entire medical team looked at how we were assessing this. And what we found with that in over 60 cases, not clean enough to like publish, but definitely clean enough for us to know, yes, this is what we're doing, at the rate of about 72% symptom resolution in less than 3 treatments for acute cases, and over 52% in chronic cases. So it was enough for us to say, yes, this really does work. In our attempt to try to shorten them, we worked with a practice out of Atlanta that does a lot of professional athletes, hundreds of NFL players every single year. They are one of the go-to injury recovery teams in the country. And they would use their units at the same time as hyperbaric. They have an amazing program, and they would do a lot of clinical data and really assessment. We wanted to try to get them into half. And one of the cheats that we used to have in traditional FSM was we would take a long program and split it in half and run it on 2 different units at the same time, which would tell you whether or not the frequencies are what are really important, right? Because we're just doubling in on those frequencies. And what we found is that the results went down into the 20% range when we did that. So to me, that immediately told me, and this was, mind you, this was years ago. So this was before we had the data about the ATP. I said, there's something to the effect of just running microcurrent and increasing the cellular ATP that is part of this healing process. So that's why there's definitely some positives to the long programs and having that outcome. Now, that said, I was actually just working with a gal who is a PT working in concussion. She's like, I have this traditional men's unit, Vanessa, can I just run it? And I said, you absolutely can try it. And she said, we just don't see the same kinds of changes at all. And so it really is most likely, based on what we see clinically, it's really this integration between the frequency aspect as well as that ATP, and probably a component of that collagen and elastin. All those tissues are still tissues the body needs to heal, even when we're talking about some brain types of tissues as well. So yeah, today, where our concussion programs are used in, amazing programs like yourselves. We have them peppered with a number of elite training facilities, elite injury specialists. They are used a lot in the NFL. I don't think there's many teams that have not been touched by our technology. Some of them integrate us right into their training room. Some of them actually, we have deals where their players get like a team discount, and then the vast majority of we have tons of players that just buy their own units. So they're definitely out there. And I think a lot of times people like to hear that, there's not a lot of hard data. I would love to have a practice, create some data and publish it. As a manufacturer, that's not always something, we don't have patients, so it's not something we regularly do. But I definitely see this would be a slam dunk for some graduate PTOT, right?
Yeah, absolutely. I know we're always looking for people too to help us push the research forward. But so then I know we've talked about its use with concussion, and after effects, like I briefly mentioned, are typically, there can be depression, there can be more mood related kind of disorders, anxiety, that sort of thing in the mental health aspect. So what is your thought then on how the microcurrent impacts? Because I know you've recently developed attention, depression, and anxiety programs as well. Can you speak to that a little bit?
So yeah, absolutely. We quickly realized that in microcurrent world, FSM world, that we definitely had frequencies and a potential impact into mental health, emotions. Most people feel happy after they get any of the treatments, and that is probably an endorphin release. And I shouldn't say probably. There is one paper that actually points towards an endorphin release that happens with microcurrent when you hit the right frequencies. In frequency world, we call that smush, and it's actually a change that you can feel in tissues when you hit the right programs. We have amazing programs for things even like PTSD. Early versions of this technology are in a longitudinal, meaning long, lengthy. I don't know when we'll ever get the results for an actual research project done in the military for PTSD. And that I know I saw the original raw data that came out of the clinical study, which is a thing that they do quickly to see, is this worth doing? And they moved from clinical study into full study within 2 months because the data was so compelling that it really does help with these things. So there are frequencies that there's actually a frequency for emotional aspect. There's frequencies for things like trauma. And those are absolutely things that we have built into programs for, yes. And I name them very creatively. Anxiety is for anxiety, depression is for depression. It doesn't mean that you're going to replace like medications. You're absolutely not going to do that. But we've had a lot of people able to wean or get off of those under their doctor's advice, using this as a more natural intervention. The nice thing too about this type of technology is, unlike if you try a medication and you're trying another medication, many times you have to change, or many times when you overlap, there's different side effects. Our technology can be used concurrently with medications, whether those are supplements or whether those are pharmaceuticals. There's really no issues with utilizing those in combination, which is really a great asset to our clients. Because we're not forcing them to give up something that might be at least kind of helping in order to get them that next level up as well. Yep.
So a lot of times too, with electrical stimulation types of units, there's contraindications, meaning there are certain times that you can't use it. So we've had a couple patients who have had cervical fusions. Sometimes they have a pacemaker, that sort of thing. So is there any time where you can't use your microcurrent device?
So microcurrent, remember, it's in the millions of an amp. For comparison, most of the devices that are out there are in the milliamps, which is actually thousands. So tens units, you feel them. Neuromuscular e-stim, functional e-stim, you feel them. That's because they're at a much higher current level. Ours being so tiny, it allows us a lot more access to help people where you can't use it with a higher electrical device. So metal implants, those kinds of things, zero worries. You can run it right over it because the current's so small. Usually most things that are safe to be inside your body are safe to have microcurrent. Now that said, with pacemakers, it's a little bit of a precaution. It's not contraindicated, but it is contraindicated for things like TENS or neuromuscular. It's too high. But with ours, it's not that it actually can change or affect the pacemaker. It does seem to help heal and normalize the heart. And that's not something that you really want to do when you've had a pacemaker. So what we tell people with pacemakers is above or below. We don't run the current directly through the pacemaker. So if the pacemaker's at the heart, we have a client, run from the neck to the hands, neck to upper chest, or a lot of them will just go to where both electrodes are on the lower back, per se. So, and with the current, you're not probably getting as much of the current microcurrent effect. That goes between those two pads, but that frequency side it goes throughout the entire body, and we see changes all the time. I'm sure you guys see it as well. We can have it hooked up on the leg and run something for the brain, and we see it change. We actually do this with athletes all the time when we're talking about high level proprioception and integration of functional skills after changing things. So yeah, there's absolutely a lot of safety. The one time you cannot use it is in pregnancy. And that is because in pregnancy, we just don't, what we do know is that in that happiness, that endorphin thing that I referenced, when we change endorphins, it makes us happy. But when you change endorphins with a little person inside of you, we don't know what kind of impact that will be on a developing fetus. And so we're pretty hard and fast on that. I am not going to lie, we've had some clients that have cheated, but usually very consciously. So like we had one gal that had used the device for a very long time and broke her foot and during pregnancy. And she said, do I risk taking medications for my pain? Or do I risk hooking up microcurrent on my broken foot and not having to have medications? And so, so I just, I had to say, this is the rules, and this is it.
Make an informed decision.
Again,
right.
People realize that it is so safe. Like we can use it with babies. And in a real case story, I literally went from working on one of the top local NBA stars. He was the top paid player and the Pistons at the time, and then turned around and worked on his 9-month-old baby. So it's like, what kind of technology can you have that kind of breath with, right?
Yeah, that's pretty amazing, because we had used it with a patient as well. And so we typically put it on the chest and the back of the neck on the C-spine as well. And so he was like, it's weird. He's like, I feel it in my shoulder. And so we did some more investigative questioning, and we were like, so do you have a shoulder injury? Like, because you said that microcurrent goes throughout the body. And he's like, well, actually in the car accident, that's where the seatbelt kind of hit me. I haven't really gone to get it checked out yet, but every once in a while it gives me some shoulder pain. So again, very interesting, of a correlative kind of thing as well, that it does you can feel it throughout your body when you're using it.
Absolutely. And one of the questions in that same vein is pain pumps. And again, because pain pumps are typically lower, it's a little harder to get away from the pain pump. What I tell people is typically can I guarantee that putting that frequency in and that microcurrent in is not altering how much that pain pump is putting out the medication? I can't 100%, but the caveat that I've always had is when people seek me out and they have a pain pump, it's because they have pain and the pain pump is not working for them. And so it's too small of current that there's going to be any damage to the pump. So I would say, again, be cumulative, take it just like a medication, right? So that's the only other type of question that I kind of get in that respect. But it's a real strength of microcurrent because it's so incredibly low risk compared to other types of technologies.
Yeah. And you and I have both talked about where you put the electrodes, but how do you know based on the program, like where to put them?
So believe it or not, the number one support question that we get is where to put the pads. Now there are different, just so people know, there are different ways to apply it. So in clinics, a lot of times here we use wet towels. And the wet towel is so that water will conduct the small current. That sounds crazy to people because water conducts current. You don't want to be in the middle of a lake in a lightning storm. But here we're talking about small amounts. So we want the water to really be able to carry that well. So a wet towel with these little alligator clips can be used. In that same water vein, in athletics, this is done more. You can drop the bare wires of the tips into a bath, into a hot tub, into a small pool, and that carries the current throughout the entire body of water. Wow. And so you can get multiple people treated at the same time. Very popular for our delayed onset muscle soreness program, which is like every athlete's favorite program. But for most of us, even in the clinic and home use, we use regular traditional sticky pads. We've adapted how we've instructed that over the years. Fortunately, our technology gurus have created wires where we used to have 4 wires, but They're now piggybacked so that we only have to use 2 pads. And that makes it a lot easier. And in general, we say red towards the head, blue below, meaning the red yellow pin goes towards the head, blue below, blue green below. But that said, there are now in the new manuals, there are better descriptions. So each program says, what the program is for, what suggested frequencies, any precautions, and then a little one that says red, yellow to here and blue, green to here. And then it also references you back to the new setup guide that is included in the manual. It's also included if people purchase a unit for home use, it's included as a PDF on their welcome email. And so we make sure that they have those have pictures, it breaks it down. And if you're even more visual, like me, we have a YouTube channel that now has videos that they're broken up into things like upper extremity. That's the therapy word for the arm and shoulder, the setups for the face and head, setups for trunk and spine, and then another one for the lower extremity. So they're not very long, 7 to 10 minutes usually. And it'll walk you through kind of the rationale behind. There's actually, I always say the shoulder is a great example. There's 5 different ways you can set up the shoulder. By and large, you can use any of them and you're going to be fine, right? The current gets picked up by the nerves. The nerves carry throughout the entire area. But that said, if you want to dive into the like rationale of should I put it here or here, you can go into that video and I'll give you as much nerdy information as you really want about that.
Yeah, us PTs and OTs were always good at pneumatics and that kind of thing to kind of remember stuff. So I always think of the red and the yellow as like ketchup and mustard, so that goes on the top, and then blue and green is like grounding, so it's like earth, so that goes below.
I
But
like it.
that's just how I kind of remember which ones to
That's
put where.
awesome.
Do you think there's other settings that we, as a primarily neurological concussion clinic, could be using that we probably haven't? I know we have our favorites that we use, but do you think there's other programs and settings that we should be using?
So there's always more. So now that we've talked about the new version for the post-COVID impact, I'm sure you guys are going to be chomping at the bits to get that one on people.
Absolutely.
A lot of our programs have not changed over the years. But there are definitely kind of next levels. I name the programs so that they're very intuitive. Attention focus is called attention focus, right? But what people don't realize is attention focus is a frontal lobe program. Right. So you get that, I get that, but you can use that for any other kinds of dysfunctions that are related to the frontal lobe. And so early dementia, Alzheimer's, those kinds of conditions are really good. Lewy body. We have a number of programs that get a little bit more specified. So when you get into complex kinds of things like MS, a lot of times you can get by with using other programs. So the nervous system reset program is a brain stem program. It's a brain stem pituitary, deep kind of brain aspect. But so that clears a lot of kinds of things. The things that are not as standard on a lot of devices are things for like temporal lobe. We have to start to get into adding those. That said, you guys have the complete concussion programs, and those are comprehensive programs. One of the funnest stories I ever had about using the concussion program is I had a 12-year-old that came in and she'd had a pretty significant concussion. Her trainer at her school had told her, go see Vanessa, get hooked up on this device. They didn't really understand it. Mom, I think, was actually a little apprehensive about this idea of putting current on her young child's head. And we typically, for concussions, we will go from the back of the neck to the forehead, so that we're right in the head. It's tiny current. The only downside is sometimes the optic nerve can pick up the current. You get what I call a light show. If people find it novel and entertaining, I can't replicate it. If people get kind of weirded out about it, you can just lower the current, and usually just moving it changes it. So it's a kind of a rare thing that happens when the optic nerve picks up the actual current. But so she got through the treatment. It's the 2.5 hour version 1. And Mom called me a week later. She did great on her scat and her out the door assessment. But she called me a week later and said to me, so my daughter, I think I told you she has dyslexia. and could this program heal her dyslexia? And I said, in all honesty, I'm like, I have never seen that happen before.
Right.
But what I can tell you is that the device, that program is set to heal dysfunction, trauma, injury to the brain as a whole.
Mm-hmm.
And so theoretically, I guess that could happen. Like, and she goes, oh yeah, we had her retested yesterday and her dyslexia is gone. So it kind of shows you the power of, like, if you just go at, I mean, those concussion programs are long, but we use those for strokes. We use those for MS. We use those really as a first line of defense for anything that's really kind of brain related, as well. So it's our comprehensive programs to target trying to heal the brain. And that's I would say that's never a bad thing. So that's really kind of the basis of that for groups that really have specific needs. And we can kind of look at what your programs are. I think you have a number of them. I think you might even have temporal lobe. Those are usually kind of the only ones that we really need to kind of add in. It's usually more for people who have had strokes in that specific brain part. So yeah, so there's, I mean, I just, like everybody, there's so many that you can do.
Yeah.
Just, yeah. And what we've known is that there's so much more to our programs. Our programs are made to be easy access, makes sense, nerve traction for nerve traction. But sometimes people don't realize that there's dual purpose behind some of these. Rotator cuff is a good example. Most people know what a rotator cuff injury is. It's your shoulder, but it's really a joint tendon program, right? So if you have an issue with a tendon, so like a quad tendonitis, you absolutely can use the rotator cuff program for that quad tendonitis, because it's really a joint plus a tendon. So there's always kind of, and we do try to make ourselves really accessible for those kinds of questions. We don't charge for that kind of support. The other side is that over time, we're building up. Right now we have a home unit. We call it the next level. It's a course I did a couple of years ago that delves into all of the programs of the home unit. It's an entire one-day program that delves into all of the nuances of what's the real difference between bone fracture and bone pain and bone bruise, right? And where do you use all those, and why do you have 3 different bone programs, Vanessa? And it's because every single one works in different environments, in different situations. And so it's knowing when to really kind of do that. It's in the manual, but it is there. There is the next level. I did teach a pro course on a next level for the pro programming last year. So that one should be in our new HoweRT Academy online. Those are full day courses. There's usually a charge for those. The charge is based on how long the technology has been out there. And then they're also available in person. I run a national annual Microcurrent conference. And that conference is available in the fall. And this year it's in October. It's in Arizona because I live in Michigan. And so I don't think I need to explain. And so, but it's also available for practitioners virtually as well. So we have virtual attendees, some regulars that come from literally all over the world, India, Thailand, and it's pretty exciting to see people from all over the world. So yeah, so that's the short answer. We'd have to delve into everything. I think you guys have it. Like, you guys have great outcomes, and there's always more. There's always fun stuff, but yeah.
Yeah, a lot of our clients have that brain fog, that lingering brain fog. So do you have something specifically for that?
It's the attention focus.
Is it the same one?
It's just the attention focus. It's on all of our units. And the other side is, though, if that brain fog is really related to some of those post-COVID changes, then we really have to address that. And what we've found is that there's kind of a magical methodology. The full post-COVID master inflammation reset, if I kind of want to dive into that a little bit deeper, it's the vagus nerve and the impact that happens to the vagus nerve, and then how that communicates to the brain stem and the deep autonomic and automatic parts of the brain, and then how it communicates with the immune system. And so what happens in all of that dysfunction is what we typically see on the outside is the body starts fighting inflammation through autoimmune pathways, which is not really very efficient. And so the body ends up not keeping up with inflammation, and we get in this inflammation overload that can be represented in general pain. It can be like, brain fog, lethargy. It can be fibro flares. It can be flares or creation of fibromyalgia or fibromyalgia-like symptoms. And so what we found is it's really about, you have to do through the entire process, and you have to do it you got to fix the vagus, then the brain, then the immune. And for some reason that methodology really gives us kind of the best results with that. So yeah, so there is a shorter version, like I said, and we'll make sure you guys get that on some of your units.
Great.
That really is more within the hour. I think it's an hour and 15, but it's just so much content. It's too much to, and it's too critical. It's really,
Right.
it is it. If there's ever some times where people are like, maybe I should have one of these in my home, it's the post-COVID program.
Yeah, absolutely.
Because we've really been all exposed to it. And, I get a lot of questions of, do you think it's a vaccine versus having COVID versus spike protein, and contamination into the community? I don't know. I don't know. I don't want to say I don't care. I think we have to be pragmatic of who needs this. And the answer is just about everybody. And then we just get it out there. And really, it doesn't really change I don't think it changes the spike protein. I think we have to do other means to do that. And we are working on some good supplementation approaches here in my own practice for that. And that combination's really been critical to really knock this out for people. So, yeah.
That's amazing. Way to go.
So how many patients do you use this on, like percentage wise, are using on most of your clients? Do people seek you out yet for it?
Not yet for it, even though we do have it on our website that we use it, but we would love to use it. We think obviously, like you just said, everyone could benefit from it. Some people just don't really like the sensory aspect of the electrodes, because it is interesting to note that sometimes when we're doing Convergence therapy and we activate that accommodative reflex and the cranial nerves for the eyes to make you cross your eyes or to look far, depending which one we're working on, they can feel like almost like a little bee sting. And so we do decrease the settings on that. But some people, they want immediacy. They do want to be like, oh, once and done and it healed me. Other people, as you know, it almost requires, like, because they're so bogged down, it does require a little bit of a buildup. So we try to encourage people, well, maybe you didn't feel immediacy, the last time, but can we try it a couple more times? But like I said, we really use it on especially those people who haven't been able to tolerate sessions elsewhere, either doing that vision remediation or just they can't stand being in their own skin. So we do use it a lot. We use it, I'd say, with like 90%, at least we've used it once with them, to see if they want to continue using it. And like I said, we do try to encourage people to be like, to try it again, just to see if it's more of a cumulative impact for them.
I can tell you why you're sensing that. So the devices are actually smarter than what they look like. Not that they don't look dumb, but they're actually more intelligent than people think. And so when you turn on the unit, it's running a current from the positives to the negatives, right? And you're using pads. So pads do tend to be the most sensory. The wet towels tend to be much less sensory. So if you get somebody that's really sensitive, sometimes just the wet towels can take that away. But the other part of it is when you first start running a program, it is actually communicating to itself. It is sending current from the positives to the negatives and then back and forth. And when you first turn it on, you'll notice the red lights kind of dance. And that is it talking to itself. So if I put in there that I want it to be at 100 microamps, meaning 100 millionths of an amp, it will talk to itself and assess that to make sure that it is at 100. If it's not getting through at 100, so maybe there's some residual like lotions on the skin that is creating some resistance, or just a natural resistance to the skin, the units will increase voltage, which is drive, to make sure that it gets that 100 microamps. Now, voltage is what we feel. So many times what that is that little zippiness at the beginning is the device talking to itself and adjusting that voltage. So for people who are really sensitive, the way I get around that is I will start the unit while it's hooked up with them. and then I will hook up. You can hook up one because it's not going to conduct if you, and then just keep one unhooked. And after I start it, I lower the intensity. So I might take it all the way down to 30, 40, then plug in. I do this for kids too. Then plug in the second or the second pin, and you'll be past that period of that high voltage, and you'll lower it. So just there's always little tricks to that. So we have lots of little tricks to
yeah, and we've definitely tried that. It's interesting though. It's usually like later in the session, like after they've been on for like 40 minutes. And it's just because I really do think it's like activating that sympathetic nervous system, and they're really starting to amp up a little bit. And it's kind of like, yeah, telling you to back down.
And Calm, the Calm Rest program, which is on, there's a version on the Pro units, there's a version on the home, and I'm pretty sure there's also a version on the rehab. That is specifically for calming down that sympathetic response. And so what we actually think theoretically is that there's so much change happening with the system for the person that the nervous system's not really quite sure how to integrate all that in. Now, if the person just gets up and leaves, the body will integrate it. It might take a few hours, it might take half a day. But if you run the Calm Rest, takes it right away. And it really kind of calms that whole system, that fight or flight. The other side is if you know people that are really going to be sensitive like that, I do use that one early on to just kind of really get the healing into the nervous system before we ask it to do much more.
Yeah. Well, this has been absolutely amazing. I appreciate you coming on here and speaking to your technology and letting us know. It's informed me a little bit more on how it works so I can educate patients as well a little bit more. And I love that we use it, and I love that we've connected, and I love that you are helping me help more people. So I'm sure that's amazing for you, because that's
it is, and that's the blessing for us, is to work with amazing practitioners like yourself that are really out there. I don't want to say in the trenches, but in many ways in the trenches, helping people day to day. And I always tell people we wouldn't exist if it weren't for amazing practitioners using the technology, getting it out there, and actually healing your communities, healing yourselves, healing the world. So thank you from HoweRT.
It's been amazing. Thank you for helping us.
Absolutely.